The human gut microbiota consists of trillions of microorganisms that influence digestion, immunity, metabolism, and even neurological function. When this delicate balance is disrupted, various health issues may arise. One of the methods developed to restore this microbial balance is fecal microbiota transplantation, FMT, commonly referred to as a stool transplant. FMT involves the transfer of beneficial bacteria from a healthy donor's stool to a patient with dysbiosis, using specially prepared solutions. It can be administered via colonoscopy, nasoduodenal tubes, or more recently, in capsule form. And the primary goal is to recolonize the gut with a healthy and diverse microbial population. To date, the only scientifically validated and regulatory approved indication for FMT is recurrent Clostridioides difficile infection, particularly in patients who fail to respond to standard antibiotic therapy. In such cases, FMT has demonstrated success rates ranging between 85% and 90%. Due to these outcomes, the U.S. Food and Drug Administration, FDA, has granted controlled use approval for this specific condition since 2013. Beyond C. difficile, FMT is being explored in numerous conditions, including ulcerative colitis, Crohn's disease, irritable bowel syndrome, IBS, obesity, insulin resistance, autoimmune disorders, and even neurological diseases like Parkinson's and autism spectrum disorder. While some studies have yielded promising results, the efficacy of FMT in these areas has not yet been confirmed through large-scale, randomized, controlled trials. As such, all non-C. difficile applications of FMT are considered experimental and require ethical approval. Despite being perceived as a natural therapy, FMT carries risks. There have been documented cases of multi-drug-resistant bacteria transmission, particularly ESBL and CRE organisms, as well as immune reactions and new gastrointestinal symptoms post-procedure. In 2020, the FDA issued formal safety alerts emphasizing the need for rigorous donor screening and pathogen testing. Recent advancements aim to reduce these risks by moving away from whole stool samples and toward purified microbial preparations. In 2022, the FDA approved Rebiota, the first commercially available standardized microbiota product in capsule form. These developments are paving the way for more targeted and safer microbiota-based therapies. Research is also progressing in personalized microbiota profiling, with the goal of designing individualized microbial treatments based on each patient's unique gut ecosystem. Although still in its early stages, this approach represents a significant shift toward precision medicine. Currently, fecal microbiota transplantation is only accepted as standard treatment for recurrent C. difficile infection. All other indications remain under clinical investigation and must be approached with scientific rigor and regulatory oversight. Promoting FMT as a cure-all without sufficient evidence is not only misleading, but also potentially harmful to patients and the medical community. Modern medicine is grounded in evidence-based practice and scientific accuracy. Maintaining this standard is essential to protecting both patient safety and the integrity of the medical profession. Unproven claims can only be transformed into valid treatments through strong data and long-term research. Please don't forget to like our video and subscribe to our channel. Until next time, stay healthy.